always want to use the 6 rights of medication administration. So you want to have the right patient, the right medication, right dose, right time, the right route, the right documentation. So I'm going to wash my hands, and I'm going to check my physician's orders and my medication administration record. For Skip Rocker, there are some orders for insulin. So there's a Humulin, NPH, 20 units subcutaneous before breakfast daily, and the Humulin regular subcutaneous per sliding scale twice daily. So we're going to drop the 20, but we also have to figure out how much of regular insulin to use. For the sliding scale, 200 to 249 would be 10 units. So 10 units plus 20 units equals 30 units altogether of insulin that we're going to draw up. So I'm going to go into my medication room. I'm going to select my vial. So I have my NPH and my regular. We want to, if it's already been opened, you want to check that they put the right date, time, initial, and the right expiration date. If you're just opening it, you want to label it correctly, and they're good for 30 days. So you just want to check that. These are good. You're going to rotate them without shaking them for up to a minute because you don't want any air bubbles in them. So just kind of rotate, get them mixed up. So you want to clean the tops of your insulins with your alcohol wipe. You want to make sure you have the insulin syringe U100 because we're going to draw up 30 altogether. So you're going to open this up and uncap your needle parallel to your body on a clean surface. So you want to draw up 30 units of air. And you are going to first inject into your cloudy NPH. And without touching the solution in the bottle, you just want to inject the air into the air. And you're going to inject 20 because that's the amount that you're going to be taking out. You can pull this out, and then you're going to inject the other 10 of the air into your regular insulin. You're going to flip it over at a 90-degree angle, and you're going to draw up 10 units of insulin. You can firmly tap it if there's a bubble in there. And you're going to have another nurse with you, and she's going to be checking that you're pulling out the right dose. So she checked that I got 10 units of the regular, and then I'm going to flip that upside down, and then I want 20 units of my NPH. Flip it upside down, and then I'm going to draw all the way to 30. Try to tap out some bubbles, and this one you have to do exactly to 30, otherwise you have to restart by getting a whole new needle and redoing your medication again. So you're going to have your nurse check the 20 that you just added. She checked, and we have 30 altogether. So you can put this back upside down. We are going to recap the needle using the one-handed technique where you want to scoop it up not touching the needle to any of the sides of anything, and fastening it at the hub. So we're going to take this into our patient's room. Hi, my name is Abby. I'm going to be your student nurse today. I'm going to do 2 patient identifiers. So I'm going to check their wristband and ask them their name and date of birth. I'm going to explain to them the procedure and the medications. So I have your insulin that we give you. There's going to be 20 units of your NPH and 10 units of your regular insulin. So there's 30 units of insulin altogether. So when choosing your sites for the insulin, they're going to be a subcutaneous injection. So you want that adipose tissue, you don't want to do it into the muscle. So you can do it in your lower abdomen, but you want a 2-inch radius, not to do it around the belly button. You can do it on the backs of the arms or the very tops of the thighs if you need to. You can position your patient either sitting or laying, whatever is best for what kind of injection you're doing. So we're going to put some gloves on. For my patient today, we are going to do it on their right lower quadrant. So I'm going to clean the site that I'm going to use with an alcohol swab. You want to start in the middle to the outside. You want to allow time for it to dry. You can remove the cap parallel to your body. And you're going to kind of want to pinch the skin that you're going to be using. For an obese person, you're going to inject this at a 90-degree angle. For an average size person, you're going to use a 45-degree angle. You will want to inject it, and you can stabilize it with your finger. You want to inject it slowly, very slowly, so you're stabilizing it with your finger. And you're gonna remove it smoothly and gently. You're going to put this in your sharps container. You can blot it dry with a gauze pad. You don't want to rub or massage the area, and also advise the patient not to rub or massage the area. Then you're going to go into their medication administration record. You're going to document the 2 insulins that you gave, the dose, the route, the time that you did it, and then initial it. And then these here were my calculations. And I'm going to do in my narrative notes that the patient tolerated it well. And I'm going to document the site that I used, which was the right lower quadrant of the abdomen, and I'm going to sign it.